Auricle, we provide live classes for the student in which there is direct interaction of the faculty with the students. Then also on Auricle, all the first year student will have the access of all the subjects anytime, anywhere through the recorded sessions. And also we provide notes that are with CBME based question answers, MCQ, and full zone for self-assessment. And MCQ also there from beginner level to expert level, which consist standard multiple choice questions. The student can also book a personalized slot for counseling session in which you will get a direct interaction with the counselor. On Oracle, we have some subscription plans starting from basic to premium. So basic plan starts from 15,000, that is of 3 months, standard plan of 6 months of 30,000, and premium plan is of 12 months, that is of 50,000. And also in premium plan, all the student will get services like pre-recorded classes, live class, live doubt clarification, one-to-one personalized guidance, note, quick revision examination module. And also for instant 20% discount, you can use my code Anchal20. So starting with today's topic. So before proceeding, we have a clinical case scenario that we're going to learn today. So a 45-year-old patient present with fever, chills, malaise, laboratory investigation revealed leukocytosis with a left shift. Which of the following condition is mostly likely causes these findings? So leukocytosis means there is increased in WBC count, and with a left shift means there is increase in neutrophil consumption. Okay, so we have the option like viral infection, bacterial infection, autoimmune disorder, and allergic reaction. So we will discuss this clinical case scenario in the end of the session. So starting from the introduction part, so as we know, blood may be separated into a clear fluid composed of either serum or plasma of unformed elements which contain RBC, WBC, platelets, and natural killer cells. So talking about the components of the hematologic system, so we have plasma protein like albumin, globulin, then blood form elements in which we have RBC, platelets, WBC. Then whenever we centrifuge the whole blood, so we get this plasma, we get black packed cells, and also we get FFP, that is fresh frozen plasma. So plasma is around 55%, leukocytes and thrombocytes are less than 1%, and erythrocytes are rest. So leukocyte form elements, as we have leukocytes, erythrocytes, thrombocytes, and talking about the primary function of blood, so as we have discussed, the main function of the erythrocytes to transport oxygen and carbon dioxide. The main function of the leukocytes to protect body from infection as it provide defense mechanism. Then in platelets, the main function is to promote coagulation, means clotting of blood. So talking about the WBC, or they are also known as leukocytes. So we know these leukocytes are colorless and nucleated formed elements of blood, right? So WBC that defends the body against organisms that cause infection and also remove debris, including dead or injured host cells of all kind. So basically the main function of these leukocytes to provide defense mechanism. Whenever any foreign particle or any illegal body entered into the body, so the leukocytes provide defense against those illegal particles, right? And they provide a very important function that is known as phagocytosis. Through phagocytosis, these WBC helps in eliminating those foreign particles, right? So talking about the morphology, so compared to RBC, the WBC are larger in size and lesser in number, right? And these cells are more important like RBC because their role in defense mechanism of body, and also they protect the body from invading organism by acting like a shoulder, right? So they act primarily in tissue but are transported via circulation. Another thing that we should discuss, that as we have discussed, these cells are larger in size, right? And they are irregular in shape because as they provide the function that is phagocytosis. So that's why they need to change, keep changing their shape. Okay, so they always have irregular shape, but they are nucleated. The nucleus is present. Okay, and also they are of many type, and those types are also we're going to discuss. And there is appearance of some granules in some WBC. Okay, so granules are present in some WBCs and also they have shorter lifespan as compared to RBC. The lifespan is of only some weeks, whereas in the RBC the lifespan is of 120 days. Okay, so this is all about the leukocytes. And also talking about the function. So their function is to provide defense and immunity, right? So this is all about the basic morphology of these WBCs. Okay, now talking about the normal count. So normal count range between 5,000 to 10,000 cubic millimeter. Okay, now talking about the classification. So the classification can be remembered by using this mnemonic, that is never let monkey eat bananas. Means neutrophils, lymphocytes, monocytes, and eosinophils and basophils are there, whereas these two cells, mean lymphocytes and monocytes, are considered under a granulocyte. Means there is absence of granules here. So A refers to means absent. So these two cells are considered under A granulocytes, whereas the neutrophil, eosinophil, and basophil are considered as granulocyte because there are presence of granules in these cells. Okay, so lymphocytes and monocytes are considered as A granulocytes, and neutrophil, eosinophil, and basophil are considered as granulocytes. Okay, so this is all about the classification of WBC. Now we're going to understand all these cells one by one. Okay, so first we have, starting from the granulocytes. So as we know, depending upon the staining property of granules, the granulocytes are classified into three types. The first we have neutrophil. So what are these neutrophils? So neutrophils are also known as polymorphs. Okay, why they are known as polymorph? Because they have smaller granules in the cytoplasm. Okay, and these granules take acidic and basic stain, and when stained with Leishman stain, which contain acidic, eosinic, and basic methylene blue, the granules appear violet in color, right? And the main property of these neutrophils that they are multi-lobed. Okay, the number of lobes in the nucleus depending upon the age of cells, right? So in the younger cells, the nucleus is not lobed, but in older neutrophils, the nucleus has 2 to 5 lobe. Okay, so this should be remembered when the cell is younger. So that time it doesn't have any lobe, but as the age of the cell will proceed, so it can contain from 2 to 5 lobes. Okay, now talking about the diameter of the cell. So diameter of the cell is 10 to 12. Okay, and they are embryoid in nature. Okay, so this is all about the property of neutrophil. Then second we have another granulocyte, that is eosinophil. Now what is this? They have coarse large granules in the cytoplasm. Okay, so they contains large granules in cytoplasm, right? And those granules are stained as pink or red with eosin, and nucleus is bilobed. So another property is that nucleus is bilobed here, and the diameter range between 10 to 14 mu, right? Now another thing we have basophils. Okay, so also basophils have coarse, large coarse granules in cytoplasm. Right? And these granules are stained with purple blue, with methylene blue, and the nucleus is bilobed here, and also the diameter of the cell range between 8 to 10 mu. Okay, so this is all about the granulocytes. Now next we have agranulocytes. So in agranulocytes, we have two types of cells. The first we have monocyte. So the monocytes are the largest type of WBC. Okay, these are the largest type of WBC. And talking about the diameter, so diameter range between 14 to 18 mu. Here the cytoplasm is clear because there is no appearance of granules, and the nucleus is always round and oval. And sometimes the nucleus could be horseshoe shaped. Please remember, the nucleus could be horseshoe shaped or bean shaped. Okay, here the nucleus is placed either in the center of the cell or pushed to one side, and a larger amount of cytoplasm is seen in these types of cells, right? So now the last one we have, the another type of agranulocyte we have, lymphocyte. Now, what about lymphocyte? What are the properties this lymphocyte has? So, the lymphocyte does not have granules in cytoplasm, as it is a type of agranulocytes, and the nucleus is again bean shaped here, or it could be kidney shaped also. Right? And nucleus occupies the whole of the cytoplasm, means it will be like this, almost occupying the whole of the cytoplasm, right? And a rim of cytoplasm may be seen, or sometimes it cannot be seen, right? So we can see the rim is available, but in some time, in some lymphocyte, this rim cannot be appeared, and the nucleus is occupying almost all the part of the lymphocyte, okay, of the cytoplasm. Okay, so this is all about the different type of WBCs. Now, next we have the normal count, right? So as we know, the normal count is, in healthy individual, the normal count is range between 4,000 to 11,000 cubic millimeter of blood, right? And talking about in infant, so it is always larger. So in infant, it is about 20,000. Right? And talking about the physiological variation of the WBC, right? So talking about the physiological variation, so always remember that the WBCs are always, WBC count is always greater in men when compared with women. And also these WBC are minimum during morning and maximum in afternoon. and also they increase with exercise and they decrease during sleep. Another thing also there, that these WBC increases in condition like pregnancy or during any emotional condition like anxiety, fear, stress. Okay, so in those cases also the WBC count increases. Okay, so this is all about the physiological variation. Now we're going to talk about the pathological variation. So, pathological variation, before learning about pathological variation, all the students should learn two terminologies. The first we have leukopenia, and second we have leukocytosis. So, what do you understand by leukopenia? Leukopenia means decrease in total WBC. Okay, so this means decrease in total WBC. Right? So this decrease in total WBC can be occurred due to any kind of condition like cirrhosis of liver or during disorder of spleen, in condition like pernicious anemia, or due to presence of typhoid inside body. Okay, so in these cases the condition of leukopenia in which there will be decrease in total WBC will arise. Now another thing we have, the another terminology, that is leukocytosis. Leukocytosis means increase in total leukocyte or total WBC. Okay, so in which condition this condition of leukocytosis can arise? In condition like infection, during any kind of allergy, then in condition of common cold, then after common cold tuberculosis. Okay, so these are all the condition in which leukocytosis, and these are all the condition in which leukopenia can be arise inside body. Okay, now another thing is also there in pathological variation. All the students should learn granulocytosis. Granulocytosis means abnormal increase in granulocytes, right? And fourth, we have granulocytopenia, means whenever there is abnormal reduction in granulocyte. Okay, so this is all about the pathological variation that we were talking about. Another condition is there that is known as leukemia. Okay, so this leukemia, we should understand that leukemia is a type of blood cancer that is characterized by production of large number of WBC, including both mature and abnormal WBC. Okay, so there will be accumulation of both type of WBC inside body, mature as well as abnormal, and the causes of this leukemia is majorly due to genetic mutation of DNA in bone marrow cell. Always remember. Okay, then we have common signs and symptoms. So in common signs and symptoms, we have the symptom like persistent tiredness inside body, the appearance of weakness or due to weight loss. The condition of weight loss can be arise. Then pain in bone or pain in joints, right? Then another thing that could be frequent infection, bleeding. So these are the common signs and symptoms of leukemia. So this is all about leukemia. Then another thing we have the lifespan. Okay, so lifespan of WBC is not constant actually. It depends upon the demand in the body and also it depends upon the function. Okay, so the lifespan of the cells may be shorter as half a day or it may be longer for 3 to 6 months. Okay, but the normal lifespan we talk about, so it is about 1 to 2 weeks. Okay, then another thing we have properties. The properties of WBC. So in properties, we first learn a very important property, that is dapsidasis. So this is the process by which leukocytes are squeezed, right? Leukocytes are squeezed through the narrow blood vessels. Okay. Then another thing we have amoeboid movement. So the neutrophils, monocytes, lymphocytes show amoeboid movement that is characterized by protrusion of the cytoplasm and change in the shape. Another thing we have chemotaxis. So chemotaxis is the attraction of WBCs towards the injured tissue by the chemical substances which release at the site of injury. Then the last we have, and the most important is phagocytosis, right? So phagocytosis is shown by the cells like neutrophils and monocytes in which they engulf the foreign bodies by means of phagocytosis. So this is all about the properties that is shown by WBC, right? Now, another thing we have the variation, right? So in variation, we learn about some kind of disorders like the first we have neutrophilia. So neutrophilia means increase in WBC. Okay. And this neutrophilia can be occur because of whenever there is any kind of acute infection present or due to any metabolic disorder. Right? Then another thing we have neutropenia. Neutropenia means decrease in WBC count, particularly neutrophil. Here also neutrophil. Right? So this could be due to bone marrow disorder, or in case of typhoid, could be due to vitamin deficiency or could be due to any autoimmune disease. Then another we have eosinophilia, means again increase in WBC or increase in eosinophil, and the cause could be due to allergic condition like asthma or could be due to blood parasitism. Okay. Then another thing we have eosinopenia. So again, penia indicate the decrease in eosinophil. Again, the cause could be due to Cushing syndrome or presence of stress, right? Then another we have basophilia. So again, philia indicates increase in basophil. The cause could be due to smallpox, chickenpox. In case of smallpox and chickenpox, the count of basophil will increase. Then next we have basopenia. So basopenia means decrease in basophils, right? So the basopenia could be in case of stress or due to prolonged exposure of chemotherapy. Right? Then next we have monocytopenia. So again, penia indicates decrease in monocytes. This could be arise in case of AIDS or in case of chronic lymphoid leukemia. Okay. Then next we have monocytosis. So again, cytosis indicates the increase in monocytes, right? And the causes could be in case of malaria, in case of Kala Azar. So these are the causes of monocytosis. Now next we have lymphocytopenia. So again, penia indicates decrease in lymphocytes, right? And the causes could be due to malnutrition, due to radiation therapy. So these are the causes of lymphocytopenia. And the last we have lymphocytosis. So the terminology cytosis means increase in lymphocytes. And again, the causes could be in case of mumps, in case of rickets. So these are the causes of lymphocytosis. Okay. So this is all about the disorders and the variation that could be occur due to these pathological conditions. Okay. Okay. Then next we have some slides. So as we have discussed that granulocytes are neutrophils, eosinophils, and basophils. Lifespan is 1 to 10 days. Granulocytes are monocytes and lymphocytes. The lifespan can be from months to days to months to years. Then the function is main. The phagocytes are neutrophils, eosinophils, basophils, and monocytes, and cells that ingest and digest bacteria are phagocytes, and immunocytes that create an immunity. For example, we have lymphocytes. So the total WBC count, we have 5,000 to 10,000. An increase in WBC count means leukocytosis, decrease in WBC count means leukopenia, and decrease in neutrophils means neutropenia. So total count indicate the degree of response to a pathological process. However, differential count will provide a more complex evaluation for specific diagnosis, as we have seen in the different variations. Okay, so this is all about the neutrophil is the most abundant cell and it is present approximately 54 to 69%. The lymphocyte is 25 to 33%. Then monocyte are 3 to 7% and eosinophils 1 to 3% and the basophil less than 1%. So talking about the characteristics, so as we have seen, the diameter range between 9 to 16 micrometer. The cytoplasm is pink, and then lobes can be 2 to 5. The day's lifespan is 5 days, and the granules are present but not visible. So the most numerous and best understood of the granulocyte first to arrive at the site of inflammation. So this is the first function, that these neutrophils are first arrive at the site of inflammation. The immature neutrophils are known as bands, and the mature ones are known as cells. Okay, so the mature one, which are present in percentage, they range between 47 to 63%, and the bands which are immature are range between 0 to 4%. The chief phagocytes of acute inflammation are neutrophils that increase with acute bacterial infection and trauma. So as we have discussed, the segmented means neutrophil, the mature one, and the bent neutrophils means immature, right? And a shift to the left indicate or the signal of acute stage of infection, means that many bent cells are present in peripheral blood smear. Okay. So as we have seen in percentage, the segmented will be 48% and the bent cells will be 14%. Now the functions so respond chemotactically to various stimuli, and phagocytosis of foreign particle and microbes are the main function of neutrophil. Then talking about the distributions, approximately one half of the neutrophil found in the body are attached to the endothelial lining of the blood vessels, poised to cross the blood vessel wall and attack an infection. So this is all about the distribution of neutrophil. So talking about the neutropenia, that also already we have seen. Neutropenia means decrease in neutrophil count, and most often cancerous patient in cancerous patient, the neutropenia, the condition of neutropenia is present, and they are also susceptible to bacterial infection, and it could be life threatening also. The next we have the eosinophils. So eosinophils are in percentage, they are 1 to 4%. Talking about the function of eosinophils, so phagocytosis of antigen antibody complex, these eosinophils increase in allergic reaction and also in parasitic infection. The example is asthma during drug reactions, in severe poisoning. Okay, so these are all the conditions in which eosinophils can be seen. Then talking about the characteristics, so we know the diameter is 10 to 15 μm, cytoplasm is pink gray, they are bilobed, lifespan is about 1 day, and the granules are many, light, bright, and orange red. So talking about the function, so they are chemotactic, respond to complement, antibodies, and histamine, active against parasites by phagocytosis and secretion of granule content. Now, talking about the morphology of basophils, so they are less than 1%. Then function is phagocytosis. Talking about the diameter, so diameter range between 10 to 15 μm. Cytoplasm is basophilic, that is blue in color. Nucleus is not usually seen and maybe lobed. And granules are many, large, dark purples and covers whole nucleus. Now, talking about the basophil function, so they secrete substances during an allergic reaction. They secrete large amount of heparin, which is a natural anticoagulant, and also it secretes histamines, which participate in the constriction of blood vessels, bronchioles, and also intestine. Now, talking about the lymphocytes, so they are present 24 to 40%, and they are divided into two types: T cells and B cells. So T cells means the T refers to maturation. The maturation of T cells will occur in thymus, and they are cell-mediated immune response. They attack and destroy specific foreign cells. And B cells means maturation in bone marrow. B refers to bone marrow, and they produce antibody that react against foreign antigen, for example, bacteria and viruses. Also, immune response cells are there. T cells and the B cells are the primary cells of immune response. They create immunity. They fight against chronic bacterial infection and also acute viral infection, most located in lymphoid tissue but are not present in bloodstream. Okay, next we have the lymphocytes. So they are 10 to the diameter range between 10 to 18 μm, and they are cytoplasm sky blue, deep blue, and the nucleus is mononuclear, and the granules may be few. Talking about the function of lymphocytes, so as we know that the lymphocytes are also involved in the process of phagocytosis. Okay, now we have a MCQ, and all the student will have 10 seconds to answer this MCQ. The very easy one. Which of the following is the function of WBC? You have 4 options: transport oxygen, maintain homeostasis, defend against infection, and produce hemoglobin. Yes, the answer is C. Then another MCQ you have: increase in white blood cells count is indicative of which disease? Option are lupus, leukemia, anemia, and melanoma. Already leukemia we have discussed, so I think you know the answer. Yes, the answer is leukemia. Now another thing we have the process of leukopoiesis or the process of granulopoiesis. Granulopoiesis means formation of granulocytes or the formation of WBC. So for granulopoiesis, we have various stages. So one by one, we're going to learn. So the first stage, we have the primitive one, that is primitive WBC. Then second stage, we have myeloblast. Then third stage, we have myelocyte A, that is also known as pre-myelocyte. Then fourth stage, we have myelocyte B, that is known as myelocyte proper. Then fifth stage, we have myelocyte C, that is known as metamyelocyte. And the last stage we have in which we get mature WBC. Okay, so this is all about the stages of granulopoiesis. Now we're going to know the various kind of variation that comes in the development of WBC. So we're going to discuss it with the help of cell size, with the help of nucleus, with the help of cytoplasm, and also the cell division. Okay, so talking about the size of the cell, so as we know, the size of the stem cell or the mother cell is always larger. Okay, and as the cell will mature, the size will decrease. So the size of the primitive WBC is 18 to 23 μm, and as the cell will get mature, the size will decrease. So the size of the mature WBC is range between 8 to 10 μm, right? Then talking about the nucleus, so nucleus is present in a very huge bulk in primitive stem cell, right? And as the stages will proceed, so the size of the nucleus will decrease, and also it starts showing amoeboid movement. So in myelocyte C, there will be appearance of amoeboid movement. And another thing also there, that there will be wait a minute, right now we're talking about so the amoeboid movement will be seen in myelocyte C, and there will be appearance of some granules, and the granules will appear in the stage of myelocyte B. So here there will be appearance of granules. Okay, and also the size will get increased as the size of the nucleus will decrease. So the size of the cytoplasm will increase as the stages will proceed. Okay, now talking about the nucleus. So in primitive stem cell, the size of the nucleus is very greater, but as the stages will proceed, the size of the nucleus will get decreased. Okay, so here the size will get decrease. Right? Now, talking about the division, the cell division. So in each and every stage of the WBC, of the granulopoiesis, there will be appearance of division through mitosis, but the multiplication will be maximum. In which stage? The multiplication will be maximum in myelocyte B. So here, the multiplication will be maximum. Okay, and in myelocyte C, the mitosis will finally get stops. Okay, so again, we're going to revise that in granulopoiesis, we have various stages starting from primitive WBC stage to mature WBC. In primitive WBC means the stem cell, the mother cell, in which the size cell is very, very larger, the nucleus is larger, the cytoplasm is also in good size, the mitosis is present. But as the stages will proceed, the size cell will decrease, the nucleus size will also decrease. As the size of the nucleus will decrease, the size of the cytoplasm will increase. And in myelocyte B, there will be appearance of granules. In myelocyte C, the amoeboid movement gets shown by the WBC. And talking about the division, so multiplication will be maximum in case of myelocyte B, the in stage of myelocyte B, and the mitosis will stop in myelocyte C. So this is all about the process of granulopoiesis, which occurred through these stage. Now, coming back to the clinical case scenario. Yes, so we have discussed about left shift. Left shift means more consumption of neutrophils, right? And in which condition the neutrophil will be maximum. So you know the answer. Again, I'm giving you 10 seconds to answer. So which of the following condition is most likely causing these finding, in which the condition of leukocytosis there with a left shift? So we have option viral infection, bacterial infection, autoimmune disorder, and allergic reactions. You have 10 seconds to answer. Yes, the answer is bacterial infection. So this is all about the WBC. I hope all the students find this class more helpful. So if you have any kind of doubt, so you can ask me all the doubt, whatever you have, with the help of these platforms through the YouTube channel or through Instagram or Facebook, Telegram. You can connect us with these platforms. Thank you so much.